So my freshman year of college, I signed up for an internship in the housing unit at Greater Boston Legal Services. Showed up the first day ready to make coffee and photocopies, but was paired with this righteous, deeply inspired attorney named Jeff Purcell, who thrust me onto the front lines from the very first day. And over the course of 9 months, I had the chance to have dozens of conversations with low-income families in Boston who would come in presenting with housing issues, but always had an underlying health issue. So I had a client who came in about to be evicted because he hasn't paid his rent. But he hasn't paid his rent, of course, because he's paying for his HIV medication and just can't afford both. We had moms who would come in, daughter has asthma, wakes up covered in cockroaches every morning. And one of our litigation strategies was actually to send me into the home of these clients with these large glass bottles. And I would collect the cockroaches, hot glue gun them to this poster board that we bring to court for our cases. And we always won because the judges were just so grossed out. Far more effective, I have to say, than anything I later learned in law school. But over the course of these 9 months, I grew frustrated with feeling like we were intervening too far downstream in the lives of our clients, that by the time they came to us, they were already in. So that's where Health Leads began. We started with the prescription pad, a very ordinary piece of paper, and we asked not what do patients need to get healthy, antibiotics and inhaler medication, but what do patients need to be healthy, to not get sick in the first place. And we chose to use the prescription for that purpose. So just a few miles from here at Children's National Medical Center, when patients come into the doctor's office, they're asked a few questions. They're asked, are you running out of food at the end of the month? Do you have safe housing? And when the doctor begins the visit, she knows height, weight, is there food at home, is the family living in a shelter? And that not only leads to a better set of clinical choices, but the doctor can also prescribe those resources for the patient using Health Leads like any other subspecialty referral. It's called health care, a system where doctors can prescribe solutions to improve health, not just manage disease. Same thing in the clinic waiting room. So every day in this country, 3 million patients pass through about 150,000 clinic waiting rooms in this country. And what do they do when they're there? They sit, they watch the goldfish in the fish tank, they read extremely old copies of Good Housekeeping magazine, but mostly we all just sit there forever waiting. How did we get here where we devote hundreds of acres and thousands of hours to waiting? What if we had a waiting room where you don't just sit when you're sick, but where you go to get healthy? If airports can become shopping malls and McDonald's can become playgrounds, surely we can reinvent the clinic waiting room. And that's what Health Leads has tried to do, to reclaim that real estate and that time and to use it as a gateway to connect patients to the resources they need to be healthy. So it's a brutal winter in the Northeast, your kid has asthma, your heat just got turned off, and of course you're in the waiting room of the ER because the cold air triggered your child's asthma. But what if instead of waiting for hours anxiously, the waiting room became the place where Health Leads turned your heat back on? And of course, all of this requires a broader workforce. But if we're creative, we already have that too. We know that our doctors and nurses and even social workers aren't enough, that the ticking minutes of healthcare are too constraining. Health just takes more time. It requires a non-clinical army of community health workers and case managers and many others. What if a small part of that next healthcare workforce were the 11 million college students in this country? Unencumbered by clinical responsibilities, unwilling to take no from an answer from those bureaucracies that tend to crush patients, and with an unparalleled ability for information retrieval honed through years of using Google. Now, lest you think it improbable that a college volunteer can make this kind of commitment, I have 2 words for you: March Madness. The average NCAA Division I men's basketball player dedicates 39 hours a week to his sport. Now, we may think that's good or bad, but either case, it's real. And Health Leads is based on the presumption that for too long, we have asked too little of our college students when it comes to real impact in vulnerable communities. College sports teams say, we're going to take dozens of hours at some field across campus at some ungodly hour of the morning, and we're going to measure your performance and your team's performance, and if you don't measure up or you don't show up, we're going to cut you off the team. But we'll make huge investments in your training and development, and we'll give you an extraordinary community of peers. And people line up out the door just for the chance to be part of it. So our feeling is, if it's good enough for the rugby team, it's good enough for health and poverty. Health Leads 2 recruits competitively, trains intensively, coaches professionally, demands significant time, builds a cohesive team, and measures results. I kind of teach for America for healthcare. Now, in the top 10 cities in the US with the largest number of Medicaid patients, each of those has at least 20,000 college students. New York alone has 500,000 college students. And this isn't just a sort of short-term workforce to connect patients to basic resources. It's a next-generation healthcare leadership pipeline who have spent 2, 3, 4 years in the clinic waiting room talking to patients about their most basic health needs. And they leave with the conviction, the ability, and the efficacy to realize our most basic aspirations for healthcare. And the thing is, there's thousands of these folks already out there. So Mia Lozada is chief resident of internal medicine at UCSF Medical Center, but for 3 years as an undergraduate, she was a Health Leads volunteer in the clinic waiting room at Boston Medical Center. Mia says, when my classmates write a prescription, they think their work is done. When I write a prescription, I think, can the family read the prescription? Do they have transportation to the pharmacy? Do they have food to take with the prescription? Do they have insurance to fill the prescription? Those are the questions I learned at Health Leads, not in medical school. Now, none of these solutions, the prescription pad, the electronic medical record, the waiting room, the army of college students, are perfect. But they are ours for the taking, simple examples of the vast, underutilized healthcare resources that if we reclaimed and redeployed could realize our most basic aspiration of health care. I believe that we all have a vision for healthcare in this country. I believe that at the end of the day, when we measure our healthcare, it will not be by the diseases cured, but by the diseases prevented. It will not be by the excellence of our technologies or the sophistication of our specialists, but by how rarely we needed them. And most of all, I believe that when we measure healthcare, it will be not by what the system was, but by what we chose it to be. Thank you.